Today, we're joined by Snohomish County Executive Dave Summers, Snohomish Health District Health Officer Dr. Chris Spitters, and Snohomish County Department of Emergency Management Director Jason Biermann. Each of our speakers will give an update, and after each of them have shared their remarks, we'll take questions using the chat feature. Please submit your questions to everyone so that all of the speakers can see. Thank you again for joining us, and with that, I'll hand it over to Executive Summers.
Great. Well, thank you, Heather, and thanks for joining us today. Good to see you all. I just want to start by thanking Governor Inslee for understanding our unique circumstances here in Snohomish County and looking at the data. Our curve is plateauing, and it really makes sense to us to pause and see if we follow the same pattern as last year with a significant drop in the spring. So let's hope that plateau and drop off continues as it did, or occurs as it did last year. We know our small businesses and their workers have really borne the brunt of the shutdowns over the last year, and we want to keep them as open as possible. So this will be greatly helpful. We continue to be focused here in Snohomish County on getting more vaccines into arms. That's the one tool we know that can really get us over the fourth wave and the pandemic. So vaccinations is top priority, but keeping masks on and getting your friends and family vaccinated will help us really get to the other side. So that's our focus for the coming weeks. I'd also like to mention that we're really excited by the news that there may be an approval coming soon for everyone 12 and older to get the Pfizer vaccine. And we are ready if and when it comes, and we'd encourage people to get their vaccines now, though, before the next wave of eligible folks start signing up. But we're looking forward to that news on the Pfizer vaccine for people 12 and older. So with that, I'm going to hand it over to Dr. Spitters from the Snohomish Health District. Doctor.
Well, thank you, Executive Summers, and good afternoon, everyone. Just before going into COVID, I just want to mention that this is National Nurses Week, and as a physician, a patient, and a family member of patients, I'm very grateful to all the work that nurses do, not only for us at the Health District and in the healthcare system here in Snohomish County, but throughout the state and the country and around the world. Nurses are a great contribution to our world, and I, as a physician, and all of us as patients and community members, are better off for all that work that they've been doing. So thank you, nurses. It's also multiple weeks this week in public health, Clean Drinking Water Week. So, that's something we take for granted, to open the tap and have clean water come out and not worry about whether we're going to be sick 24 to 72 hours later. That wasn't always that way. It is now, thanks to basic infrastructure and that is now good public health that's just taken for granted. So two items there of good news, and a third item, moving on to COVID. Heather, if you could share the slides. I've just got a few slides to share today around our COVID situation, both in terms of morbidity and vaccines. So let's start with that. Heather's got the first slide up there, and that just shows our total cases by week. Each bar is a week, extending up through the week that ended May 1, last Saturday. And you can see we hit 1,000 cases for the first time since mid-November of last year. The increase continued, but as Executive Summers mentioned, and I'll show you in a minute with our rate, things may be plateauing both here and statewide. Again, the driving factors in this recent fourth wave, certainly the variants that have emerged and are now displacing previously circulating strains of the virus, particularly the B117, which is 50 to 70% more transmissible than its predecessors. And so that's driving things, but also, human activity, gatherings. We're certainly seeing increased activity in employment settings as well. So it just speaks to the importance of prevention measures up front, and for all of us to get vaccinated as soon as we can. Next slide, Heather. Now, This next slide has this very similar appearance to the case slide because it's just translated into a rate per 100,000 over the last 2 weeks. This is the one we've been showing every week for a long time. And as Executive Summers mentioned, we kind of got a stay or a pause on what otherwise would have been movement into phase 2. As you can see, we crossed that threshold a week or two ago, but again, that plateau just kind of moving sideways from 223 to 229, and hopefully that's a signal of sustained improvement and ideally seeing that curve turn down. Vaccination is the means to further bend this curve and ultimately arrive back to a new normal, enjoying things like that we like to do and being able to do the things we must do and that have all been put on hold for so long. It's also for a safer, healthier community that we do that. All 3 vaccines are safe and effective, carrying an overwhelmingly positive benefit to risk ratio. Get vaccinated with the next vaccine you can. Until then, those of you who are not vaccinated, continue to engage in the standard prevention measures we've come to know so well. Next slide, Heather. And so this just shows our hospitalization rates, very similar shape to what we saw in the previous 2 slides, because the hospitalizations have mirrored the case and rate curve, because that's where the hospitalizations come from. Saving us in this wave is the good vaccine coverage in our older populations that accounted for so many of the hospitalizations and deaths in the prior waves. Due to that good vaccine coverage, we've seen a dramatic reduction in deaths. We haven't had very many deaths, just I think in the last 2 weeks, it bumped up a little bit to 8, but previous to that, just two deaths in the prior 2 weeks, way off of the peak of the 3rd wave where we were having more than 30 or 40 deaths a week. So that just speaks again to the effectiveness of this vaccine. And on the other hand, we are still seeing hospitalizations occurring in younger adults, 40 to 59 years of age primarily, but even hospitalizations in people down into their 20s. So although younger populations are at lower risk, they're not at 0 risk, and our middle-aged adults are still at substantial risk. So it's very important, not only for the health of others to prevent transmission through vaccination, but also for our own health. Today we have 44 people in Snohomish County hospitals with COVID, 3 of them on ventilators. Next slide, please. So there's been a lot of coverage lately and conjecture about a decrease in appointments and vaccinations in Snohomish County and throughout the state, and it is true. Over the last week or so, we have noted a decrease in uptake of appointment slots in the county's mass vaccination sites, and I've heard similar reports from vaccine providers in the healthcare system. When the target for completion is the entire population over a short period of time, we're bound to encounter a slowdown from time to time. Still, even with a decrease in the pace of our progress, countywide, we continue to administer tens of thousands of doses weekly. We have fully vaccinated almost 250,000 residents in less than 5 months, and almost 600,000 people or almost 600,000 doses have been administered. And as you can see in this slide, there are another 100,000 or so people, that gap between the fully vaccinated and the initiating vaccination, about 100,000 people who are looking to get that second dose done. This has been a remarkable amount of work in a short period of time, and we are very grateful to our county government and healthcare system partners who have helped us get this far. So the good news is all that progress. The bad news is that the low-hanging fruit, I think, has already been picked. Our healthcare workers, other high-risk occupations, older adults, and other highly motivated residents have been addressed. Now it's time to work on the rest. A very small proportion of the population may simply be opposed to the vaccine. However, I'd caution you not to make more of that than it is. Sadly, this is true for many vaccines. Others may be hesitant for a variety of reasons, many or most of which ultimately can and will be overcome with information, access, and probably seeing or hearing of people like them also getting vaccinated. And yet others just have busy lives, maybe a lower perception of risk, a lower personal sense of urgency, and or they face logistical barriers to getting it done right away. So now we're entering a phase where there's a little more work, more planning, more flexibility needed, and a little more outreach needs to come into play to help these other folks get across the line. People need time to plan ahead. They need vaccines closer to where they live, work, and play. And Jason will share more information on those efforts in a moment. Next slide, please. We have just published our latest monthly vaccine demographic report, and that's now available on the Health District website under case counts. And then on that page, go to the icon in, not on the left, not on the right, but in the middle, snapshots and reports, scroll down and you'll find it there. Here's the breakdown of the just over 300,000 residents who had been vaccinated through April 18. As you can see, as we go down the rows, looking at the last column, the percentage, the last two columns, the percentage of people initiating and completing vaccine improves with age. And we, as I said earlier, over 70% of individuals 65 and up have initiated, 60% have completed. But you can see in the younger age groups where we're seeing most of the cases, much less complete coverage. And they got a later start, but it's time for us to catch up and try to curb that transmission that is leading in those age groups. We're also anticipating that the FDA, the Food and Drug Administration, will grant Pfizer's request to expand the emergency use authorization for that product down to a lower age limit of 12 years this coming week or the week after. We anticipate that the vast majority of adolescent vaccination will occur through these children's medical homes in the primary care setting. Yet we are also engaged in planning with local pediatric vaccine providers, county emergency management, and the State Department of Health on the full set of options that may emerge for achieving good coverage and vaccination of adolescents and ultimately younger children. Next slide, please. Now this slide gives us a look across race and ethnicity groups and how we're doing in terms of the proportion of that group that's covered. So the denominator for all of this is each group's total population in the county. And then the bars going from left to right, green, orange, and navy. Green is mid-February, vaccination through mid-February, then through mid-March, and the darkest bar through mid-April. This is the proportion of that group's population that has initiated vaccination. And so you can see at the current time, looking at the dark bars, non-Hispanic whites, Native Americans, and people of African ancestry, all in a similar range there, just over a third, almost 40%. Out ahead are Asians and Pacific Islanders. And then lagging a bit behind are the Latinos. And the good news with the Latino group is we recognize that in some of the early analyses. And I'll also say that Latinos formed a smaller proportion of the early eligibility groups. So they kind of got started late as a group because they didn't have so many eligible, smaller, older populations, smaller population of healthcare providers. Now they've been catching up through a greater proportion of their population being eligible as new phases open up, and now we're wide open. And then the work that the county's vaccine task force has been doing to reach out to the Latino community has led to a great catch up. So you can see that they've quadrupled the proportion of the total population just since mid-March that has been vaccinated. So again, miles to go. We got a long way to go, more catch up to do, and all of us, need to get further up in, our goal is to see every person in Snohomish County who wants to be vaccinated get fully vaccinated. And, the public health goal, I think, is at least 80% of the population, ideally 90%. So we've got a ways to go. So moving on now to share more about the Snohomish County Vaccine Task Force efforts, I'll turn it over to the county's Director of Emergency Management, Jason Biermann.
Thanks, Dr. Spitters. Good afternoon, everyone. Thanks, Executive Summers. Yeah, I'm going to reiterate, Executive Summers and Dr. Spitters have both mentioned how critical vaccines are to all of us. And just that getting your vaccine is one of the easiest and most effective ways that we can all protect ourselves, each other, lower our number of cases, make sure that we can continue moving forward in reopening. Dr. Spitters mentioned we've now administered nearly 600,000 doses in Snohomish County. Over 40% of our population has started their vaccination series, and the Vaccine Task Force continues to work hard at it. We are doing everything we can to bring vaccines closer to our residents. We've done community-based clinics, which are going well. We're continuing to schedule those with community partners around the county. We've helped vaccinate at clinics that have been hosted in community centers, at churches, and that's in addition to the work that we've already been doing with vaccinating folks at long-term care facilities, adult family homes, senior housing, shelters, and even in people's homes for the homebound. We're really grateful for the partnerships that we have with a number of different entities that are helping us get closer to the community members, because that really is important. Today, I want to really highlight, though, how important our mass vaccination sites are. They're really important because of their throughput, their ability to get a lot of people vaccinated quickly. Unfortunately, as has been mentioned, we are starting to see a pretty significant drop in how many folks are booking vaccination appointments at our mass vaccination clinics. Like many places around the country and the state, this happened very abruptly here in Snohomish County. The week of April 19th, we were filling up appointments very, very quickly. The last week of April, we've seen appointments stop filling up much slower than the pace we've had for the previous months. So, speaking of that, we've been operating our mass vaccination sites now for a little over 4 months. And I just want to take a minute to talk about the impact of what happens when these appointments aren't filled. As some of you probably know, we did a significant media push, community-wide push this past weekend, because we had more than 600 doses of Pfizer vaccine that were going to go to waste on Sunday. Those were doses that had been planned for use, had been thawed, and once thawed, they have to be used within a specific time frame. When folks either don't show up for their appointment, or we do an estimation of how many people will show up, and then we don't have enough people that actually show up there because we have to project our anticipated throughput for a vaccine site, we run this risk. So in addition to not getting people vaccinated, we run the risk of wasting vaccine, which is something we have been determined since day one to not do, and so far have been very successful. And in this case, thanks to all the hard work of lots of folks, including many of you who are representing news outlets on this briefing, we were able to get all of those doses out. None of them were wasted. And so that's a good thing, but it just shows how impactful this is when we don't fill up appointments at our mass vaccination sites. It was a lesson for us in that while we avoided wasting vaccines this particular time, we have a lot of work to get the rest of Snohomish County vaccinated. As I mentioned, we've been doing this for 4 months. For 4 months, we've had very high demand and struggled with supply. Now we're seeing a fairly steady supply and not seeing as high of demand. So we are making changes. We do want to improve access, and we do want to make sure that everyone knows vaccines are available, that it's super important that you get vaccinated, and that getting your vaccination at our mass vaccination sites remains quick, easy, and safe. So some of the things we're doing. Last week I mentioned that we're releasing appointments a week ahead of time instead of just a day or two in advance. We're also expanding hours, particularly on the weekends. This week we'll have 3 sites, Boom City, Ashway, and our Edmonds College site that will be open on Saturday, and 1 site, our Ashway site, that will be open on Sunday. We're going to continue to look at additional weekend and evening availability as we move forward. We understand from hearing feedback that folks need the opportunity to get a vaccine off of normal work hours, and we're trying to adjust so that we have more availability. We're also doing something that we've seen have some success around the country, and that's moving away from requiring appointments in advance. We've done some on-site registration recently, including on Sunday at our Ashway site and on Monday at our Boom City site. On Sunday at Ashway, as we were trying to get rid of those vaccines that were in danger of expiring, we had about 300 people who arrived without an appointment, and we were able to get them vaccinated. So we're looking at piloting what we're calling a flex clinic at Arlington, and that's actually happening today. So people were able to book appointments online or over the phone, like we've been doing throughout the entire mass vaccination effort. But anyone who shows up today between 9 and 4 without an appointment, we will sign them up on site. And as long as we have doses available, they'll receive their vaccination. And starting tomorrow, we're going to start treating all of our sites that way. So again, we encourage folks to make an appointment. We really encourage folks to make an appointment. But if you show up, we don't want registration to be a barrier. So if you show up and we have vaccine that is still available, we still have doses available, you will get vaccinated. We will register you on site. I want to remind folks that you can call if you're having a hard time navigating the online system. The call center is still open from 8:30 to 4:30, and I believe we can put the number in the chat. So we're doing everything we can to make these vaccines available. I want to reemphasize the importance of the MassVac sites. Those are sites where we can literally get thousands of people through in a day and help us move toward that goal that Dr. Spitters mentioned. I'm going to close with saying this is everyone. Please get your vaccine if you haven't. If you've had your first dose, get your second. If you're fully vaccinated, tell people about it. Tell them how easy it was. We're getting lots of feedback about how easy and smooth the process is. We know that when folks hear this firsthand from family and friends, it improves their confidence and they want to go out and get vaccinated. If you have to, help them get signed up. Direct them to our phone number at the call center. Direct them to the website. For the entire year, we've talked about how we're in this together. We were in it together at the beginning. It's going to take all of us together to get out of this. And so just asking everyone to do their part. And with that, I'll close and turn it back over to Executive Summers.
Thank you, Jason, and kudos to you and the team and the health district, everybody that scrambled and worked so hard over the weekend to get those doses administered. That was, I know it was quite a push and a lot of work, and just once again, you guys are amazing. So thank you to everybody for that. So let's see. Let me go to the questions. What is the county seeing in terms of folks failing to come back for a second dose? And has it changed at all in the last month?
Well, Jason may have a better view on that from the mass site perspective. I think just overall, we're pretty steady as we roll forward over the past 6 to 8 weeks. Consistently 65%-ish of people who initiate vaccination have completed it. And so I think we're just going to continue rolling forward until, we're no longer, until either everyone's, gotten initiated or everyone that's going to initiate vaccination has done so. And then that 65% will click forward up, hopefully very close to 100%. I don't think the gap is either widening or shortening. I think it's just a function of the process, and we're doing pretty well there, if you ask me.
Yeah, and I'll simply add, we recognize that it was a challenge for folks, and we have started second dose clinics. We know there were challenges early on with folks knowing when to get their second dose, and again, early on, sometimes not having vaccine availability. As I mentioned, we've got availability now, so it seems like most people are aware now that we've got more availability and they can make their second dose appointments. But I do think there's a bit of lag of people who were frustrated or heard about the frustrations early on. So it does, to Dr. Spitter's points, feel like it's fairly level. But we've had some instances where second dose clinics appointments don't fill up as fast. So I just want to reiterate to folks that there are lots of different ways you can make your appointment, and we do have a fairly steady supply of vaccine now, so please do so.
Yeah, and that second dose does count. You get good protection for the short run once you're a week or two out from that first dose, but to really get a long-lasting coverage, go back and get that second dose.
So next question was, are you breathing a sigh of relief with the governor's pause announcement? And I'll jump into this one and say, absolutely, yes, we are breathing a sigh of relief. The pause is very helpful, but we know we're not off the hook. We have to keep going and emphasizing and prioritizing vaccinations out to people, and we will do that. But we know our restaurants and restaurant workers and many folks in the community are really hit hard by these rollbacks. So this is extremely helpful. And again, just grateful to the governor for looking at that plateau we seem to be exhibiting here in Snohomish County and giving us time to see how that pans out. So everybody keep doing the right thing, get vaccinated, and hopefully we can turn the pause into a long-term thing. Dr. Spitters or Jason, you want to reply?
Well, yes. I mean, it's really a pause, a deferral on what otherwise would have been a very difficult thing for the county, and so I'm grateful for that. It's also a call to action, as you alluded to, Executive Summers. I mean, this is not a break in terms of effort by the community. We need to take this opportunity. We've got about 45 or 50,000 doses coming into the county again this coming week, and in those 2 weeks we could get 100,000 more people initiated on vaccination. So let's take that opportunity. It's our turn to do so, and when your turn comes up, take that shot and let's move Snohomish County forward.
Yeah, that's the point I was going to really make as well. Is it's a sigh of relief in the sense we don't want folks to lose focus if phases had changed, but really we have vaccines available. We have availability at our sites. Please come get vaccinated. That keeps us from worrying about this in the future.
You're on mute, Executive Summers.
Words for the year. Next question is, how concerning is the steep drop-off in demand as supply becomes available, and what do you attribute this to? How much is due to finding and appointment fatigue, and how much is due to overall vaccine hesitancy?
Well, I imagine we all have thoughts on that. I'll take a shot at it first. Much of which I made in my earlier remarks, which is some of it is the low-hanging fruit part. Populations that were either greatly affected or concerned about their risk in the workplace, healthcare providers, people residing in long-term care settings, other older adults. The appointments disappeared like magic when they came up, so fast because the demand was so high. And now, we're moving into populations where maybe that sense of urgency is not so great. Maybe some people are just busy and have a hard time prioritizing it in the context of it not being as urgent, or them having, other immediate daily life needs. And I think that speaks to a lot of the efforts that Jason was talking about to try to make things more accessible going forward. I don't know that I'd overestimate, hesitancy implies this term that, well, I don't know if I want to get the vaccine. As I said earlier, we know from national and international surveys that there's probably 10 to 20% of the population that may end up being a hard no. I hope that changes and gets smaller, but it's not, we've got like 50%, almost 50% of the population, the eligible population that hasn't started yet. We're at 56% of the eligible population having started vaccines. So that's 45%. I don't think we have 45% of the population in Snohomish County that's really disinterested in vaccine. And so it's just going to go a little slower, a little harder, and not as easy as the first half, I'd say.
Okay, any other thoughts on that, Jason?
No, I think Dr. Spitter's covered most of it. I just, it's concerning in the sense that, we want to make sure that we're doing everything we can to adjust to what folks need. As he said, people are going to have different priorities. The weather's getting nice, folks are going back to work in some cases. We just want to be attentive to that and make sure that we are doing our best to adjust to that and continue to make the vaccines available.
Yeah. And just reiterate a bit, there's a lot of reasons why people haven't gotten the vaccine yet. And we need to just be really thoughtful and remove all the barriers that we can to folks, whether it's transportation or timing or even information about the vaccine safety. I know there's some folks that feel that the testing was rushed, and actually my understanding, the clinical trials the vaccine went through were the standard trials, and yes, the whole process was compressed really because the development was using technology that's been under development for many years. So it seemed very quick, but all the science says it's safe, and we need to keep letting folks know that that's the case, and just look for every opportunity we can to make the vaccine available to folks and remove those impediments. So we'll continue to focus on those types of efforts. It seems like the governor's decision came at the 11th hour. When did the county find out it'd be staying in phase 3? We found out just before this call, I'd say within the hour. So very short notice. Was a little before, well, a little before his announcement, excuse me, mixing our call with his announcement, but we found out maybe an hour beforehand that we'd be going on pause. So not much notice. Is there any possibility that Snohomish County could follow Ferry County's lead in changing their own phases for the sake of public health? Or is the thought now that Snohomish is on the right track? Doctor?
Well, the state's framework was put together with a lot of, evidence base and good scientific thought, and by a lot of smart public health professionals and people working in the governor's office with input from local health jurisdictions, local county governments, that sort of thing. So I wouldn't be quick to put it to the side. We're certainly, in state law, the local health jurisdiction always has the right, if you will, to be more restrictive, but not less than the governor or the state. But at this point, I see no reason to depart from the framework that's set forth. We're grateful for the pause. I think I hope it bears out that it made sense as we see the lines flattening on those curves, and hopefully see them coming down. And when we look back in a couple of weeks, we say few, we just had that brief mathematical swerve into phase 2, and let's get this back down with vaccination and smart personal action and keep it down.
Next question is, county seeing varying demand across its vaccine sites? It seems like Arlington is seeing the drop off more so than others. So are we seeing any differences between the sites?
No, I think generally we're seeing kind of an across the board drop off in total. It sort of depends day to day. Arlington may seem like more of a drop off because it had such high throughput, like the Monroe site. But really it's just appointments seem to be down at really all the sites across the board. So there's varying demand at each of the locations. And that's why we're trying to raise this level of awareness and availability across the board. I think it really is just that Arlington typically has a lot more appointments because it has a lot more throughput, so it seems proportionally like it's a bigger drop off, but it's been happening everywhere.
Okay, next question. We know that data shows vaccines are safe. Is there any new information on medication interactions that could impact efficacy or safety of the vaccines? Doctor?
Well, I wouldn't say, brand new information. We continue to see scientific reports emerge showing that people who are severely immunosuppressed, particularly in the context of chemotherapy for cancer, people receiving immunosuppression to prevent organ rejection after organ transplantation, those being the two probably most severe impacts on efficacy of the vaccine. And so, those groups, for instance, have lower responses to the vaccine. And because we don't know who those people are when we walk around on the street, that's another reason for us all to get vaccinated, is to help protect them. There's that. That's not brand new, but it's certainly out there. So severe immunosuppression, usually induced by the healthcare system on an individual to help them with a bigger healthcare problem, is the main problem in terms of efficacy. None of these, no new or really earlier information about any, drug vaccine interactions that would create safety or efficacy problems beyond what I just mentioned have been noted.
Thank you. Any idea when the Angel of the Winds site may reopen?
It's dependent on availability of Johnson & Johnson. So I don't know if Dr. Spitters has any insight into when we might see that coming back, but that it would really depend on that.
Yeah, and the state's forecasts just show 4,300, I think, doses coming to the state over the next couple of weeks. I can't see further beyond than that. I know there were some problems at the manufacturing level, and presumably once those get ironed out and distribution picks back up, we'll have a healthier supply of the J&J product. But that's just hopeful speculation at this point.
Okay. Is the county considering partnering with any businesses to provide some incentives to folks on the fence about vaccination?
Yes, we are. First and foremost, we're working with them. We're still doing weekly calls with business partners to make sure we're communicating availability, encouraging them to encourage their folks to get vaccinated. But we are also looking into what incentives we might be able to provide or work with them to provide. Not a lot of details. Those conversations are really early on, so more to follow on that.
Okay, and are employers required to allow employees to access COVID vaccine appointments, or is that handled on a voluntary basis?
Well, I'll take a health officer's view shot at that. That it's probably going to vary by employment site, what the employee status is, what their labor relations agreement is with the management, about whether they have essentially sick leave or time for medical care that's covered by the employer. For those who have it, great. Then they've got to stay true to those agreements, and that would be covered. If they are in an employment situation where they're not covered for sick leave or medical care, then they're probably going to have to do it on their own time or take another form of leave to open up a window to do that.
Yeah, I guess I would just add that we definitely encourage employers to reduce any impediments employees have to getting the vaccine. It's in everybody's interest, including the employer's interest, to get folks vaccinated as soon as possible. So we'll work with employers if they have questions or requests some special consideration, but we very much encourage all employers to remove those barriers. And I'd also like to say, very pleased, I personally, this is my opinion, but the governor's new guidance on sporting events, outdoor events, church services, setting up some different rules for people that have been fully vaccinated and being together. And I think allowing those gatherings of vaccinated people makes a lot of sense from the science I've seen and the data, and it really is an incentive both to the businesses but to the people to get those. And I also know UW is going to be requiring vaccines and vaccinations for its students in the fall to be on campus. So those are the kinds of efforts I think you'll see more of, where we're really creating some incentives for people to be vaccinated, and we treat them appropriately because of the science. Doctor, any other thoughts on that?
I endorse what you just said completely. I think it's a great idea to give people a choice and to encourage them to pursue vaccination for their own good, the good of that community where they go to work, play, study, what have you. I think that's a powerful incentive and a fair one.
I think that wraps us up. Thank you.
This is Heather in the Joint Information Center. Thank you again for joining us today and for your questions. We're going to wrap up for today, but please stay tuned for future media availabilities. Thank you.